Hey, everybody. Good morning, good evening, good afternoon. Welcome to Pep Talk, the podcast that gives you the truth, the whole truth, and nothing but the truth. So help us, God. I'm so excited to be taking some of these crazy, conversations in health and wellness and questions that you guys are sending to us regularly and giving you solutions for that. We're going to take a complex conversation today, break it down into some simple action steps, some things that you can do to help improve your health, the health of your well-being and your family, and etc. I'm Dr. Eric Naputi. I'm your host. Today, we're going to go down a journey. We're going to talk about bariatric surgeries. We're going to talk about the good, the bad, the ugly. We're going to talk about what you should be doing before, after, and etc. to improve the quality and health of your life. Listen, as a practicing physician for over 20 years now, especially in the field of functional medicine, I've literally had thousands of men and women who have come to me before and after bariatric surgery for many, many reasons, and they really need solutions to stay healthy because the surgery itself is not the solution. It's part of the solution for many people, but it's definitely not the end all and begin all of everything to get you healthy. And so I also have a lot of practitioners who send their patients to us post bariatric surgery in order to improve the quality of their health and prevent a lot of the problems that happen long term from the post surgical issues. So, look, I take some notes on this. I want to share some things with you. I want you to understand that, look, bariatric surgery, which, by the way, I'm not against or for. I'm supporting you one way or the other. I've had family members and I've had patients that have had the surgery and have done very well with it. I've had patients and family members that have not done very well with the surgery, and some people that have chosen not to because of, their own reasons. But I think that it's there's a lot of things you need to understand, especially if you've had the surgery. So why do some people do it? Let's talk about why would you get bariatric surgery in the first place? Well, first of all, if you're having some severe obesity, and you've tried everything, you've tried, peptides and lifestyle changes and exercise and, all the things that you know to do, and it just didn't do it for you. So look, in that case, I'm all about, yes, let's do that. Right? You're now forced to change your lifestyle because your stomach went from, a normal size stomach to about a quarter or a third of the size that it was before. So the problem is, again, a lot of people will have this surgery because obesity. Some have it because of reflux, indigestion, and GERD. Some have, other health conditions that they need to have this done. I'm all about it if you need to do it. But what I'm not about is just doing the surgery and letting you go about your quote unquote normal life without knowing what's really going on. You got to understand that most people that have digestive issues, which are about 95% of the population, especially those over the age of 30, which is obviously the most common age groups, 30 and above, who have bariatric surgeries, you're going to have digestive malabsorption anyway, prior to that. Most people only absorb about 10, maybe 20% of their foods and nutrients they take. Now you're going to have this surgery, and that might reduce your absorbability by another 70 to 80% of what you currently are absorbing. That's a problem. That's why the long-term side effects of a lot of people that have a bariatric surgery are you see them, they get fatigued, they get anxiety, they get brittle nails. Their hair starts to thin or fall out. They get crepey, saggy skin. They get a lot of long-term muscle wasting. And by the way, the quality and thickness and health of your muscles is one of the things that's going to carry you into longevity. The longevity studies show that the more muscle mass you have as you age in life, the healthier you're going to be in every aspect. Your muscle regulates your insulin and blood sugars. Your muscle protects your joints and bones. The problem is because you can only consume small amounts of foods post-bariatric surgery, man, we have massive reduction of protein absorption and metabolism. So one of the things that you've got to do is you've got to make sure that you're getting enough protein in your daily diet to help your body heal from all things. Protein is what synthesizes all the tissues, all the red blood cells, white blood cells, hormones. Everything comes down to protein. So here's kind of a rule of thumb. Whatever your ideal weight is, let's say that you should be 130 pounds. Well, you should get 130 grams of protein in your diet per day. And if you can't consume that much protein in 2 or 3 meals, you need to consume protein throughout the day, and you need to have a couple protein shakes in your diet throughout the day. Most protein shakes can give you between 20 to 30 grams of protein. Now, here's the key. I'm going to tell you that whey protein is typically not beneficial for most people. It's a milk-based protein. I always tell people throw that away. Whey protein is not good for most people. And soy-based protein is a phytoestrogen. I only recommend soy ingestion when it's fermented soy. So you got to get your protein levels up, number one. Number two, because you lose the production of your stomach, you're going to get less production of stomach acid, which stomach acid signals to the body to make enzymes. The acid doesn't break down the foods and nutrients that you're ingesting. It signals to the enzymes to do so. So I tell every single patient who has had bariatric surgery to start taking a plant-based multi-enzyme with each meal. Enzymes are a supplement you can take that helps your body break down and digest and absorb the nutrients that you're getting. And because most people lose 80 to 90% production of their enzymes once they get over the age of 30 already, now you add the bariatric surgery to it, you're causing a massive increase in enzyme reduction. And enzymes being reduced in your body can cause symptoms like sore, stiff joints, headaches, migraines, fatigue, upset stomach, indigestion, gas, bloating, reflux. The list goes on and on, including skin issues, headaches, migraines, autoimmune problems, and so much more. So supplementing with a plant-based multi-enzyme is vitally important. All right. Additionally, when you have had a bariatric surgery, your body does not absorb the fat soluble vitamins very well. So there's 2 biohacks that I tell everybody. First of all, you need to be taking everyday vitamin A, D, E, and K. A, D, E, and K. Those are the fat soluble vitamins. But you better be taking it with some good fat as well. So what I tell people to do is when you take those vitamin A, D, E, and K, which massively reduce whenever you have bariatric surgery, the absorption goes down ridiculous amount. You better have some extra virgin olive oil in your system when you take that. I don't care if you take it with a shot of olive oil, or you take the vitamin A, D, E, and K when you have your breakfast, your lunch, or your dinner meal. Make sure that you have some good fat with that meal so that you can absorb those vitamins. Also, here's another biohack. Go get some MCT oil, medium chain trans fat oil, which typically comes from coconut oil, or get organic coconut oil every day, twice a day. Put like a big handful of it in, put it on your scalp, your face, your body, your arms, your legs. You can absorb those fat soluble vitamins through your skin. Okay. So those really, really important things that you should be doing. Additionally, most people, when you have bariatric surgery, you typically have malabsorption of vitamin B12 and folate or folic acid. So go and listen, this is very important, a very specific type of B12. It's got to be methylcobalamin. Methylcobalamin, any other type of B12. When you get a vitamin and you look, like for example, this is a formula that I created called Cell Signaling. It has B12 in it. When I look at the back, it has to say B12 as methylcobalamin. If it doesn't say that, if it's cyanocobalamin, hydrocobalamin, whatever, don't take it. It's not going to work for you. Okay, you need the broken down form that's easier to absorb and easier to use. The second thing you have to have is a type of active folic acid. So there are a couple of them on the market that are good. I put that in my cell signaling formula as well. It's called L-methylfolate. L-methylfolate. You can also get something called L-MTHFR, but it's got to be an active form of folic acid. Very, very important. If not, you're going to have blood sugar challenges, hypoglycemia. You're going to have an increased risk in fatigue, anemia, autoimmune issues, and other serious complications. So let me give you a couple biohacks that you should do. Here are 10 biohacks that you should do if you've had bariatric surgery. Number 1, get with a orthomolecular practitioner. What is that? Those are doctors or nurse practitioners or providers that offer vitamin IV therapy. Listen, I can take 100 grams of vitamin C, put it in an IV and put it in your bloodstream and get 90+% absorption by bypassing your GI tract and getting it right into your bloodstream. I can only give you about 3 to 4 grams of vitamin C per day. If you have a good, healthy stomach, if you have bariatric surgery, I can only give you maybe a gram a day, and your absorption is only going to be about 8 to 10% of that. That's true for all vitamins, minerals, amino acids, and etc. Most of my patients post bariatric surgery, I have them get an IV every week for 6 weeks. Then I have them get an IV every other week for 90 days. And then most people should be getting them once or twice a month for the rest of their life. Number two, high quality targeted supplements, especially vitamin A, D, E, and K, methylated B12, methylated folic acid. Very, very powerful. Here's what I'll tell you. Calcium citrate or coral calcium is necessary with these individuals because they're better absorbed post-bariatric surgery. Number three, protein supplementation. We discussed that already. You need to get a good form of protein powder, protein shake, something like that, so that you can keep your protein levels up. Remember, your body weight, your ideal body weight in grams a day of protein is where you should be. Having small meals throughout the day, number 5 biohack, small meals throughout the day, and having protein and fat first thing in the morning and protein and fat before your, like your bedtime snack or before you go to bed is really essential for your system. Number 6, bone health supplements and exercise. Because absorption of nutrients goes down with bariatric surgery, you have a higher risk of not absorbing minerals. So one of the minerals that you can take, I'm a huge fan of seaweed. Okay, big fan of seaweed. Using things like seaweed or sea moss. They typically have 92 essential vitamins, minerals, and nutrients that your body needs to function, including the minerals to mineralize your bones. Also, having about 5 to 6 grams a day of a good, healthy, organic sea salt, whether it's pink Himalayan salt, Baja Gold salt, Celtic sea salt, they have about 70 to 80 different minerals in it. Very, very important. And doing resistance training, pushing heavy weights. You should be pushing some heavy weights. Not so heavy you hurt yourself, but we should be pushing some heavy weights. Number 7, hydration and electrolytes. Your electrolytes will be in the sea moss. Your electrolytes will be in the sea salt, but making sure that you're drinking water, a good 80 to 90 ounces a day, slowly and a little bit throughout the day is important. Or drinking green teas or herbal teas. They're very hydrating as well. Number 8, big one, probiotics and digestive enzymes. Probiotics and digestive enzymes. You should be taking a plant-based enzyme with your 3 to 4 meals a day you're eating if you are post-bariatric surgery. And there's a microbe that I use. It's called Master Microbiotic Formula. It's a spore-based master microbiotic that you can take. It absorbs past the stomach acid, has 99% deliverability and survivability to the small intestine. Being mindful of your eating, thoroughly chewing your food 15, 20 to 30 times before you swallow helps digestion, and you need as much help with that as you can. One of the reasons why bariatric surgeries fail people or they people get chronic reflux or GERD still after. It's because they're not chewing their food thoroughly enough. They don't have a probiotic, and they're not taking an enzyme with their meal. And then, just monitoring and adjusting your lifestyle. One of the things that really jacks people up is their stomach can get jammed up into their diaphragm. It's called a hiatal hernia. It's very common. If you come over here to the left side of your body and go down to the the ribs on the front, your 7th, 8th, and 9th ribs in this region, and you push in there pretty hard and you massage circularly and it's sore or it tickles, that's a reflex that you might have a hiatal hernia. You can take an x-ray, an A to P x-ray of your chest, and if the gastric bubble is up high above the diaphragm, you have a hiatal hernia. You can do things to manipulate and massage that down. You can go on YouTube and look up natural solutions for hiatal hernias. You can strengthen your core abdominal muscles. You can stretch and strengthen the core muscles of your back and your glutes. You can see a chiropractor, an osteopath, to adjust the stomach down and adjust your spine. And when you eat, sit up. If you're hunched over like this, your stomach's going to jam up into your digestive tract. So look, I'm not opposed to bariatric surgeries. I'm actually very optimistic with them as long as you do the right things post-op. You have to take care of yourself, and just eating however you want is going to lead to other diseases and diseases. So get educated, because the current level of thinking that existed with you prior to having the surgery can't be the current level of thinking existing now that can help you live a happier, healthier, and more productive life. So listen, go back, rewatch this podcast, share it with your friends and family members. Make sure you go to our website, go to peptalk.world. That's peptalk.world. Like, subscribe, and share all that information, everything that we've got going on with your social media friends and family. And my job is to give you the map, the keys, and the car. Your job is to drive it towards a happier, healthier, and wealthier you. Folks, until we meet again, I'm Dr. Eric Naputi. God bless you, God bless America, and God bless the world. Stay smart out there, and I'll see you next time. Be well.